This is Colleen Parsons with lecture number 6, part 1 for health assessment. In this lecture, we're going to be talking about the head, face, and neck, which is one of your skills assessments, and we are including the lymphatic areas of the head, face, and neck. Remember to brush up on your anatomy for the head, face, and neck, particularly your glands, the thyroid, the trachea, and the lymph nodes. This is drainage of the lymph nodes. Here are the lymph nodes, and you need to know all of these names. 4, 5, 6, 7, 8, all 9 of them. Here is the structure of an infant's skull. And if you remember, these suture areas, which are the lines that eventually will fuse together in the skull, they are not fused when a baby is born to facilitate birthing and growth and development of the child's brain. This is where the soft spot is, here, the fontanelle. There's another one back here. This is the one we pay most attention to because it's right at the top of the head. Here's aging. We continue to age through time. This is the same man. Here he is as a very young man, and here he is as an aged man. You can see that the nose continues to grow and the ears continue to grow. They're much more dominant in growth for men than women. Ears get quite large sometimes in men. That is somewhat genetically predisposed. You can see what gravity does to facial features. Here's the bottom of his chin as a young man. Here it is as an aged person. Here are the health and history questions. It is very important when you're asking about a headache or anything else that's going on with the head, face, and neck that you try to get information as specifically as possible so that the prescriber can really do a good job of helping that patient. A headache might be just a headache. It might just be some stress. It could be a migraine. It could actually be something much worse than that. And oftentimes our patients are quite concerned that it's much worse than that. They think cancer, tumors, they think stroke, all kinds of things. So you want to make sure that you ask questions like, how long has this been going on? Does this happen only when you're awake, or did the headaches continue while you're sleeping? Do they last for hours or days, or what exactly is happening? Are there any other symptoms associated with it? These are very often symptoms of a migraine, here with associated factors. A family history of headaches can be very important and can help with the diagnosis. Oftentimes, migraine headaches are associated with fluctuations in hormones, especially for women. And you might be aware that in recent years, we have become more and more aware of concussion syndrome and what several impacts to the brain that are strong enough to cause concussions and how they can affect how a person thinks today, but not just today, later on in their future, and how it impacts their aging brain. Additional questions might be for infants and children. Now, these first 2 questions you might ask of if an infant is having some head, neck, or facial problems, However, this third question is important for older children. You wouldn't ask if the baby was born by cesarean, probably, if it's an older child. For aging adults, we are always concerned about vertigo, dizziness, and neck pain, because they can cause other issues in an adult patient. And there's the end of part 1.